Hopefully this is an interesting session for you, something that may be new to some people may be more familiar with. First off, a little introduction. So unfortunately, contrary to your program, I'm not an infection prevention and control nurse. You're very much the experts in that. I'm a public health specialist registrar, which means I'm a medical doctor doing the public health training program, and I've been working alongside the public health rapid support team. So we're going to be talking a bit more about that. You're okay. Always expect the unexpected. So yeah, please do feel free to ask questions as we go along, and thank you really for joining us. It's really, really nice to see you. I should say my colleague, Amelia Hornsey, who is an infection prevention and control specialist nurse, is away actually in the Solomon Islands at the moment, working with the rapid support team, which I'll tell you a little bit more about. So a lot of this information has come from him, yeah, I'll kind of explain a bit more about what that means. So obviously we're not done with the pandemic yet, but we have very much been in the throes of what it means to be in a pandemic, and that is something that we're going to experience this century. And pandemic preparedness, which might have seemed like a bit of an academic pursuit a few years ago, is now very much part and parcel of day-to-day work and what everybody is going to be involved with going forwards. So I'm going to touch on what that means at a kind of global health level, and then as we sort of filter down what that means at sort of individual teams, and then also around the public health rapid support team. I'm going to talk a little bit about rapid response teams, which in this context, I'll explain what this means in a global health context. This is something that I did an MSc thesis on, looking at the role of infection prevention in rapid response teams. And then I'll explain more about what the UK Public Health Rapid Support Team does, what it's made up of, and the IPC role within it, which is an absolutely crucial part of the picture. So, as we know, managing outbreaks at the source, close to where they happen, is absolutely critical for preventing pandemics. It's critical for global health security. And we know that infections that can come from some source, perhaps not in the human population, come into the human population, can be amplified within healthcare settings. And we've seen in various outbreaks over the past few decades that this is really sort of sometimes a neglected area, that people are thinking of the community transmission, but not always thinking about transmission within healthcare settings. And very importantly, it often happens in early stage. So that early stage is really important for trying to prevent outbreaks becoming widespread epidemics. The role of infection prevention and control here is really important. This is, bread and butter for you, but, community infections, coming into hospital, many vulnerable people, the procedures, personal care, food, there's a lot of opportunities for transmission. So, this is just an example of where overcrowding and crowding happens in all healthcare settings. And I'd just like you to think back to 2015 or so, when there was a MERS-CoV outbreak in South Korea. And when we're thinking about pandemics, there's not really much point in just thinking about the one that we're experiencing. It's all of the ones that haven't happened up until then that are also really important, and how can we prevent the next pandemics from happening. So this is a good example because it actually was prevented from becoming a more widespread event. And what was really important was that this index case, who had been to the Middle East and had come into contact with MERS-CoV, then traveled back to Korea and went into a number of healthcare settings. We know that because of the healthcare system in South Korea, that they went into multiple different settings, because that's how you access care. But most of the other cases in this outbreak happened as a result of the contacts that they come into contact with. So you won't be able to see on screen all the detail in this image on the right-hand side, But well, it may or may not surprise you to see that this key individual right here was the one who was in hospital. And that contact was responsible, because they were in a bay with lots of other patients, that was responsible for actually the majority of cases in the whole national outbreak. So we can see that at that point it's really critical in terms of preventing the spread of diseases within the community. So let's just, at a very sort of high level, think for a moment about what it means to talk about pandemic preparedness. And we know that IPC is sort of already talked about as a core pillar of pandemic preparedness, health system strengthening, and developing global health security. So that means health systems that are able to, to adapt and to kind of tolerate a level of infectious disease outbreak are more likely to be resilient and to kind of not have the health system collapse whenever something like that happens. And this is very much part of kind of global health, of what's being discussed in terms of global health security. And one of the other kind of key elements that came out of the Ebola crisis in West Africa 2013 to 2016 was understanding that this role of infection prevention and control needed to be in the wider kind of national plans for preventing pandemics. And the UK, we've had lots of plans to prevent pandemics, to prevent the spread of infectious disease affecting society, like we've seen over the past couple of years. And the IPC is kind of needs to really be at the forefront of that. So when we think there are obviously a huge number of different pathogens that have the potential. It could be from any particular place in the world and rapidly spread within the population. So we do need to realize that a weak link in the chain anywhere is potentially a risk to global health everywhere. So I'd like to just touch on this topic of rapid response teams. And this is something that you may have within a sort of clinical setting, a team that sort of responds to a clinical emergency. And similar to that, there's a kind of wider type of team at the public health level, which can sort of respond to communities, to areas which are experiencing an infectious disease outbreak. This is one of the key recommendations coming out of the Ebola crisis, that these would be sort of formalized, ready trained, and kind of ready to go for whenever that happens. Really, if you're trying to assemble a team once an infectious disease outbreak is already happening, then you're too late. So what are these teams all about? They typically include people like field epidemiologists, so those are going to go into the field, kind of navigate the outbreak. But also, very importantly, we've kind of, gold standard would be to include infection prevention and control as part of these teams. So this research that we did was sort of look to see, well, what is the formalization of these teams at this stage? Is it sort of are these kind of being developed as we would expect? And it is something that, although it's sort of generally agreed as a good idea, and there has been a lot of formalization, it's not something that's widespread everywhere yet. The UK Health Security Agency and the Public Health Rapid Support Team have been doing a lot of work ongoing after the Ebola crisis, and particularly with the Centers of Disease Control and Prevention in Nigeria, who have really upscaled this approach and now have rapid response teams right across the country. So I'd just like to touch a little bit more on this topic of infection prevention and control within these rapid response teams. So this means that whenever an outbreak is occurring, that we should be thinking about how do we get infection prevention and control to the area that is experiencing an outbreak early. And we've all seen that in COVID-19, that's been absolutely essential to kind of get that expertise in. And although it's something that people maybe have some awareness of, actually already having those skills is really important. And so we did a number of interviews with IPC professionals, particularly this is focusing in health systems that are at risk of being overwhelmed where there is an infectious disease outbreak. But what we find is that often there's a sort of a siloed approach. The IPC professionals are within healthcare settings, whereas these rapid response teams are very much more within the ministries of health or public health institutions. And by sort of not drawing those links, then it's often being forgotten. And also, many of you may have experience working in different settings. There is a challenge of high-quality IPC training across low-resourced settings that we kind of really need to see a much wider adoption of kind of training and upskilling of IPC teams in health systems that are kind of more at risk. Something that has been a really good development, especially in the pandemic, has been this sort of regional network approach, and that's really shown a huge amount of success. So, for example, Africa CDC now have a really fantastic program where they are able to kind of share resources across different teams, and we've really seen that that's kind of sort of increased in speed and pace a huge amount during the pandemic. Okay, great. I'd now like to kind of introduce you to the public health rapid support. Have many people heard of the team before? Yeah, a little bit, yeah. Okay, some shaking of the head, some nods. So this is something that is a rapid response team that's sort of specifically designed by the UK government to deploy anywhere in the world and deploy rapidly, so within 48 hours of being asked to kind of support with infectious disease outbreak. It's a government and academic partnership, so it works between the UK Health Security Agency, formerly Public Health England, and LSHTM, and it's funded by overseas development assistance, so it's those countries that would be in receipt of overseas development assistance that the team would deploy to. And there's these sort of three really core elements around supporting, so whenever there is a threat that is potentially overwhelming the health system, that there is this sort of additional support that can kind of go in and provide extra capacity. And also this understanding that in order to sort of prevent the next pandemic, you need to be thinking about how do we prevent infections at the source rather than waiting until they've spread across borders and are affecting kind of a much wider level of society. Also, it's about, so that's sort of one reactive approach, but very much important and has to go alongside it is how do we sort of make sure that there's capacity building and kind of more long-term upskilling, especially in areas like infection prevention and control. And this is specifically focused within low and middle income countries and countries that are in receipt of overseas development assistance. That's the sort of specific rationale of the team. But very much it's working where invited and in partnership with countries to kind of provide that capacity building and improving rapid national response to disease outbreaks. These are those three really core elements, and I think it probably translates to a lot of the settings that we're working in. That it is really important to have this ability to respond quickly, but also you have to have the resilience within the system. So just to sort of touch on what the team does and who they partner with. So it's most of the deployments come through either bilateral invitations, so a country that is experiencing an infectious disease or another type of disaster that is potentially overwhelming the health system can reach out and ask for this team to come in and provide additional technical support. And a lot of those requests come through the World Health Organization, and specifically this network called the Global Outbreak Alert and Response Network, or GORN. So you will have seen on the news people like Dr. Mike Ryan, who's head of WHO Emergencies Program, and they're the organization that sort of oversee GORN. And increasingly working with institutions in different countries and continental institutions like the Africa CDC, which has sort of hugely expanded its role in over the pandemic. Also importantly, there's this very essential kind of partner called Infection Control Africa Network, which many of you may also have worked with at various points. And that's, again, it's about capacity building, sharing resources, and generating sort of information that is applicable within different settings. So I'd like to tell you a little bit more about the team itself and where they've been, what they've been up to. This is a team that we all fund and support as part of UKAID, and it's interesting to note that sort of infection prevention and control is absolutely at the core of what they do. So there's microbiologists, clinicians, social scientists, for mental health officers, and providing kind of that sort of support, along with epidemiologists and data scientists. And that means that there's kind of an approach to managing an infectious disease outbreak that is holistic, that takes into account all of the different factors. It's not a particularly big team, and it is worth noting that when you think of the whole of pandemic preparedness from every country, this is a very small and specific part of the picture, but it is one that is worth connecting with, worth understanding, and worth sort of seeing where it fits within everything else that's happening globally in terms of building preparedness. Okay, so I touched on this a little bit. This is how does the team actually deploy? So how do they kind of get involved in a specific setting? We touched on GORN, and then also the sort of joint deployment. So the emergency medical team, some of you may have heard about, is the sort of clinical equivalent. So in where there is, for example, a natural disaster, they're a group that will go in with trauma surgeons and that sort of thing to provide emergency support. And also increasingly, because of the restrictions on travel across the pandemic, there's been a lot more deployments that have happened remotely and online. This gives you a little bit of a picture of the deployments over the last 5 years or so. Some in headquarters, places like WHO in Geneva and Africa CDC, but also to quite a few specific infectious disease outbreaks. There have been quite a number in Central Asia, Africa, and Southeast Asia. And again, you can find all of this information online. I'm just sort of signposting you to it here, and also to sort of demonstrate the breadth of different outbreaks that have been responded to, from cholera and typhoid, yellow fever, several Lassa and Ebola outbreaks, and then obviously quite a few related to COVID-19. And as I said, this is ongoing, so the kind of current IPC team that are part of the Public Health Rapid Support Team are currently in the Solomon Islands in the Pacific, supporting with infection prevention control, it's sort of in quite a remote area of the Pacific. So alongside the responding to individual outbreaks, it's really important that we consider this element of research, and obviously the sort of access to these types of outbreaks is something that we may not be experiencing in day-to-day practice here, but there's a huge amount of learning that happens that can be translated to different settings. There's a lot about understanding how services respond when there is an infectious disease outbreak that can potentially overwhelm the health system, understanding what diagnostics need to get there quickly, what research can be done in that moment, and also understanding how to kind of maintain a quality of care and share that evidence going forward, so that from each outbreak or infection, there's some learning that can then hopefully inform some other environment. Again, this is going to be very small for you to see, but I just wanted to give you a picture of the different types of research that have been ongoing. There's been quite a bit around things like environmental hygiene and cleaning, a recent systematic review on that. And then also sort of sharing a lot of information around COVID-19 interventions and translating some things that may have been understood in one context, but trying to translate that into a different setting to see what would work. So yeah, quite a range of different research projects ongoing. And again, that's about kind of providing an additional support, hopefully to the point where such a team would in future not even be required because there would be kind of support and enough capacity locally. Cool. I'll just let you have a little look at some of the other more recent activities to do with the COVID-19 pandemic. And again, quite a few of these relate to infection prevention and control and developing resources and support packages to be disseminated. Also worth mentioning is this massively open online course, which has kind of been available to support outbreak response in a lot of different settings. Okay. Great, so just to touch on this element of capacity development. So what does that mean? That means providing support to systems so they can maintain their capacity even when faced with infectious disease outbreak. And this goes hand in hand with the other elements. I'd really recommend accessing some of these resources. Really interesting. You can take part in the sort of online open course, and there is a sort of online epidemic response platform, which again just is really helpful to sort of think in different settings how to provide support that will maintain the response. And also really importantly that this team has elements of social scientists, mental health support, so often a little bit more broad than what is available in local teams. It's again just a picture of some of the different elements of capacity development. The online courses have been taken up very widely, and quite a lot of kind of co-working with the Nigeria Centres of Disease Control and Africa CDC in particular. So yeah, this is the online course and an MSc level module, which again is available online and sort of trying to provide that upskilling, essentially so in future that this is a team that would no longer be required, where there is enough capacity existing. That's obviously what the long-term aim has to be. Just a little bit more to mention on capacity development. So working very closely with Nigeria CDC on Lhasa and in Bangladesh, I'll touch on that as well. There's been a lot of ongoing work with IPC teams there and providing additional kind of technical support to Africa CDC. And just to kind of particularly illustrate this partnership with teams in Cox's Bazar in Bangladesh, so due to kind of a number of recent infectious disease outbreaks, there have been a real need to sort of provide extra support to teams there in epidemiology, microbiology, and in IPC. And again, that comes as a request through this GORN system. So that's been something that's kind of been an ongoing partnership. Just to mention as well, Africa CDC, so again, this is another kind of quite big ongoing partnership to provide multiple countries with information and kind of technical support, and where people were really wanting to know how do we translate guidance at speed into something that would be appropriate for where they're working. And there's a lot of sort of ongoing work on something called the International Health Regulations. So that means that's kind of this international system of how infectious disease threats are managed and reported. and because of that ongoing partnership that this team is sort of fitted in with. And also, just to mention this Africa Volunteer Health Corps. So this is the mechanism by which IPC professionals and other professionals who are sort of can volunteer and then within Africa and then sort of share a community of practice across different countries of expertise. So again, that's something which has been very widely adopted during the pandemic. Just to kind of begin to sum up, so this online work package is something that was being really widely used during the pandemic. It was developed in partnership with Africa CDC and the African Union and the UK Public Health Rapid Support Team. There's a QR code there, do check it out. Obviously it was sort of produced at the beginning of the pandemic and some of the science and has developed since then, but this is a really useful community of practice and online resource which has been developed which could be really rapidly disseminated, and I think we have to kind of use some of those innovations that happened at the beginning of the pandemic in future, and in a lot of environments people are kind of really wanting to access this information, and the kind of speed of being able to access information has really increased. So this, in particular, the Telegram groups and online resources have been really very widely used and are really high quality. There's lots more information on the Public Health Rapid Support Team online. It is something that, although there is a small IPC team within it, they also do have reservists who, if they're required to draw on a kind of wider pool of experts to deploy, then that's something that might be of interest as well. And excuse me, I'll just recap before I lose my voice. We've gone through a little bit about infection prevention control in pandemic preparedness. And as we think about preventing the next pandemic, IPC needs to be something that's considered in every context early in outbreaks. And we need to think a little bit more broadly. Role in IPC is not necessarily just within the healthcare context, but has a wider implication on the trajectory of an outbreak. I've introduced public health rapid response teams and the role of IPC professionals within those teams, and then this sort of specific case of the public health rapid support team in the UK.